This year we've got a great session talking about genital GVHD, eye GVHD and oral GVHD, and then a scoring system afterwards. So I think it's going to be a really interesting session to look at three really hot topics that patients really suffer with. And then having a scoring system at the end of it is probably, to round this off, it's probably not as interesting as the other areas, but it gives you an idea of how to score somebody with respect to their graft versus host disease. The scoring system for graft versus host disease is dependent very much on whether or not you have either acute or chronic graft versus host disease. What we're talking about here in this session will be chronic graft versus host disease and how that's scored in the clinical environment. So looking at the presentation of eyes, of mouth, of skin, GI tract, musculoskeletal, genital and lung. And then you work out a score for each one of those areas, and that gives you an overall idea of how severe somebody's graft versus host disease is. And you can do this assessment hopefully on a 3-monthly basis, using the same tool each time, and that gives you the ability to compare one assessment against another when the patient returns after you've given them a treatment. So you can see how well that particular treatment is working, or in some cases how well it's not working, and that enables you then to change the treatment plan for that patient to try and improve things. If you've not got a good enough scoring system to use, then you're doing very much a guess day by day when the patient comes in, and it might be difficult for you to assess accurately exactly how progressive or severe their graft versus host disease is. It's useful then for people who will see the patient at a different time point, and if a different clinician sees the patient, you've then at least got something that's standardized and you can give a score to that grade of GVHD. That enables then a different clinician to be able to see how well that patient has progressed, and if the treatment indeed is working or not. The three different kinds of graft versus host disease that we're talking about in the sessions today are eyes, mouth and genital. So for people who are suffering with graft versus host disease affecting their eyes, often their eyes are really dry, gritty, uncomfortable. They have difficulty looking at bright lights. And often these people can't go outside because the sunlight is too bright, or the wind is blowing in their face, making their eyes often stream a lot with fluid. Or they're constantly rubbing their eyes because they're so sore and uncomfortable. So scoring that to see how severe their GVHD of their eyes is gives you an idea again of what treatment to use, and whether that's something as simple as just eye drops for some cases, and regular lubrication of their eyes and washing their eyes out, up to scleral lenses, or using ablation to ablate part of their eye to help keep it hydrated. With oral graft versus host disease, this can present as just a slightly tender mouth, up to the point where the mouth can start to severely deteriorate with open sores or breaks within the buccal mucosa, causing part of that to slough away. So some patients may say that they find it difficult to brush their teeth, for instance, because the toothpaste stings. Or if they have a cup of tea or a cup of coffee, they have to wait until it goes really cool before they can drink it, because the temperature of the fluid is too warm for them to be able to tolerate it. And similarly with things like crisps, or salty food or very spicy food, they find that difficult to eat because it hurts so much as they're eating it. Their mouth becomes very tender. So similarly to eyes, you want to keep the area nice and moist, so regular mouth washes and treatment with things like steroids and topical treatments within the mouth to try and address the sores and heal the buccal mucosa that's in there. As well as it being the mouth, it can also affect part of the throat coming down the back of the neck and making it much more difficult to swallow. So for people then with genital graft versus host disease, this is often a very underrepresented area, and it's possibly less discussed in a clinical environment, especially with a female patient and male staff, particularly difficult to bring that subject up as the male staff to the female patient. And sometimes the patient themselves feels slightly embarrassed or concerned about bringing something up which to them is a massive problem, but they may feel that it's not a big problem for the clinical team to be looking at. But genital graft versus host disease is incredibly debilitating for some women, and indeed some men. It's even less reported in our male population because they often ignore this. So it can present again with pain, discomfort, some scarring in women, narrowing as well, so unable to have penetrative sex because it's so uncomfortable and painful. And again, often dryness goes with this. So referrals through to endocrine teams, seeing somebody within your department who may have a specialist interest. I'm very fortunate here at the Christie Hospital that I have a lady called Angela Leather who's incredibly interested in vaginal graft versus host disease and runs a women's specific clinic for this and sees our patients very regularly with the use of dilators, lubrication, creams, and advice from our endocrine colleagues about HRT. So we have a whole plethora of things that we can give people to try and get on top of these systems. So once somebody's got graft versus host disease, as I say, it's then really important to score and grade this so you can see how people are responding to their treatment.